We learned just devastating news today on the Today Show this morning. The husband of Today co-host Chanel Jones has died. 45-year-old Uche Ojei had been battling an aggressive form of brain cancer privately. Jones and Ojei were married 17 years. They had three beautiful, beautiful children who you see here. The Today family honored the life of Ojei, calling him a devoted husband, a loving father, and a man whose bright spirit touched everyone who knew him. He suffered from the most common and most aggressive type of primary brain cancer in adults called glioblastoma. Last month, singer Michael Bolton revealed he's been diagnosed with the same kind of brain cancer. And joining us now is Dr. Anik Desjardins. She's director of clinical research at the Preston Robert Tisch Brain Tumor Center at Duke University. Dr. Desjardins, thank you so much for being here. I think so many people are struck by how young and seemingly healthy that Uche was. It's hard for us to wrap our minds around the fact that it could take someone like him. How common is this type of cancer?
No, and thank you for having me. No, I agree. It is heartbreaking when, anyone is diagnosed with cancer, but, when someone's so young with a young family. So glioblastoma, this type of brain cancer, it affects about 12 to 13,000 Americans every year. It is not, even if, it is the most common of all the primary malignant brain cancer, as you said, it is still a small number of patients, 12 to 13,000 patients, but of course, very devastating.
What's the typical prognosis for someone who is diagnosed with glioblastoma?
Yeah, unfortunately, so the survival of our patient, and that's why, right, we're doing so much research, but unfortunately, when a patient is diagnosed with a glioblastoma, normally they're being told that their survival is about a year and a half. So normally between 14 to 20 months, depending on their health, the quality of, can they have safely a surgery? How do they tolerate the treatment? But normally less than 2 years.
Are there signs or symptoms that people can look out for? I mean, does it start with an intense headache or something entirely different?
Exactly. So most of the time, a glioblastoma, because it's a tumor that progresses or that grows rapidly, most patients will show up with a headache that is unusual, right? We all have headache every day, but a headache that, or not every day, but we all have headaches once in a while, but a headache that is worse than the normal or gets worse from day to day to day. So most commonly headaches, sometimes speech difficulties, sometimes a new weakness or new clumsiness. That's normally how it shows up.
And quickly, I know people come from all over the world to get treatment for glioblastoma at Duke University. Why? What are you all doing there? And is it extending people's lives?
Yes, no. So what we're doing, which is very different than other centers, is that we're really at the forefront of bringing new therapy. What I mean by that is we're really, really involved in a lot of research of developing or discovering new mutation, new reason why glioblastoma shows up, and then associated with that, really treatment directed against that. So that's why patients come, as you said, from all over the world to get treatment at Duke for primary brain tumor, for glioblastoma.
Gosh, I know so many people around this country are praying for a cure. Our hearts are with Uche Ojei's family. Dr. Desjardins, thank you so much for your time.